Today we're going to talk about a simple protocol that Ayurveda follows to give patients the lifelong cure that they require. We consult in over 50 plus countries and most patients often ask us that we have this disease since birth, since childhood, this ichthyosis fish skin since 30-40 years. How do I, treat it? I've applied various moisturizers. There's atopic dermatitis. My eyebrows have shed off, my hairs have shed off, the skin texture, discoloration is there. There is so much of itching irrespective of applying every single cream that's present, but still I have the disease, this psoriasis, this eczema, this 4-5 years recurrent fungal infection. So all these diseases, on what basis is Ayurveda saying that lifelong cure, or what basis Ayurveda is providing results to the patient? What is that protocol that is followed? How are the results seen? What really happens in the system wherein the results are seen? Let's understand in a very easy, simple way in this particular video. Namaste everyone, welcome to Jovi's Hospital of Ayurveda and Aesthetic Center, Mumbai. Ayurveda is considered as highly effective for incurable skin diseases. For diseases where there is no cure, Ayurveda treats the roots. The reason being, for every disease there are not just the herbs and combinations, not just the internal external treatment, but there are varieties of panchakarmas and treatment modalities. For example, if there is a skin disease or just itching, along with Dravya, internal, external, there are so many options, like there is the Vidya Karma, Agni Karma, Dhumapan, Vranaropan, Vranadhavan, there is Vaman, Virechan, Basti, Nasya, Siravid, Alabu, Shrunga, Gati Yantra, there is, the Shirodhara is there, simple, there is the Potli Pindas Ved. You can say so many different protocols to give the patient result from the pain, from the itching, from the burning, from the discharge. It's just that patient must be serious enough and must show efforts that yes, you do it, I want the results. If that is the approach, treatments are done. Mostly patient is unaware of the Ayurveda treatments. Patient just knows that Ayurveda is equal to the bitter herbs, powder tablet and the external oils. But Ayurveda is beyond that. The herbs are used because patients are not that ready for the procedures, or we see that Vidya Karma for skin or Agni Karma for skin is rarely practiced anywhere. We see the Siravet for patients of burning. We see the Vaman on a daily basis for different treatments, different diseases, barely used. We see cases of Vidya Karma to give relief from the stubborn itching, barely it is seen. So mostly we see that Ayurveda herbs are practiced, but just for patients' knowledge, Ayurveda is beyond the use of just herbs. Just for the information that for one disease, there are different treatment modalities that cures the roots and gives the complete results. That's about it. We've also spoken about 25 do's and don'ts that one must follow if you have itching, if you have a skin disease. We've spoken about home remedies, about simple do's and don'ts, simple things one must follow, what are the causes of skin diseases. So all these videos are there. I'll put the link in the description. Make sure you go through it. Let's understand this video, understand the simple protocol. Ayurveda starts its treatment with number one is expelling the krumi, using Krumigna Davaiya, Krumigna Dravya. So we see if the patient is of Vat Kafach Prakriti, we use herbs like or medicines like Krumi Kuthar Ras. If the condition is Pittach, then Krumi Mudgar Ras, Vidangasa, Vidangarishta, Bilvadi Gutika. We see single herb usage as per the Prakriti. How do you know the Prakriti? An authentic Ayurvedic practitioner will diagnose in the right way and then choose the right amount of herbs or the right kind of herbs based on that particular Prakriti and Vikruti. So many herbs. First step, Krumigna Ushadi. Krumigna Davaiya, Dravya like the Ushir, Musta, Vidanga, Devdaru, there is Chavyak, Akuparni, there is Bharangi, there is Bilva, Nirgundi, so many Krumigna Dravyas. First step, expel the worms, whatever worms are stuck to the deep layers of the intestines, eliminate. Second is correct the dosha vitiation. Whichever doshas are increased, do the shamana, do decrease the doshas that are increased through the herbs, or whatever is increased, take them off, eliminate them through the panchakarma. Panchakarma, if a lot of dryness, Vata is imbalanced, Basti. Pitta, then do the Virechan or the Rakta Mokshan. If it is cough, a lot of cough in the body, a lot of swelling, itching, do the Vamana. If the Pit is associated with Rakta, Rakta Ashuddhikaran and Pitta, burning is there associated, do the Rakta Mokshan with the Jaloka, Siravet, Alabu, Gati, Shrunga. So many different modalities are explained to deal with the dosha vitiation. Third important point, correction of metabolism. Fourth important point, diet and lifestyle changes. 25 points I've mentioned that have to increase itching anyhow. So make sure you watch that and make a note and try to avoid it as much as it is possible. Link you will find in the description box. Fifth most important point, it is also very necessary that we must give some temporary relief to the patient. Patient must get symptomatic relief at least. There are two kinds of damages. One is the damage that is going to happen, and one the damage that is already happened. So the damage that is already happened is irritating the patient, hence some symptomatic relieving treatments like the oils, like the paste, like the the medicated grita application, certain paste to be mixed with curd and applied, mixed with water and applied. Curd, water, what it does, it pulls the infection, medicine kills. Pulls the infection, kills the infection. Pulls the infection, kills the infection. Every patient coming to Ayurveda has years and years of suppression. Take an example, your anus, urine, tract, we've just stopped it. The toxins will build up, just imagine. Skin with steroids and application, it is stopped. Number of toxins all below the skin. So high time we, treat the root, get out everything in a very invisible way without any irritation, and we treat that, suppressed disease that is there beneath the skin. So that's about the 5-step simple process protocol that is followed. Although if itching is more and there is psoriasis or any disease, the disease is treated and not the symptom. The patient has already come to us with various treatments for the symptom. There is, A for A, B for B. There is dandruff, ketoconazole, fungal infection, luliconazole, psoriasis, clobetasol. Years and years, same treatment is going on. We've seen patients, 5, 10 treatments done. Luliconazole used of A brand, luliconazole B brand, luliconazole C brand, luliconazole D brand. Same brand. The patient is also telling that this A was more effective, B was less effective, C was more effective. The medicine is same. Brand names change. There are patients who have used all brands in Mumbai, all brands in Bangalore, all brands in Pune, and now understands that, I need to go something beyond that. I've been all these years using the same. I realize it after 5 years. So this is something that happens most of the time. So what is important is, rather than giving relief or focusing on the itching, it's important to focus on the disease. Once the disease is gone, the itching will go on, completely disappear for life. The immune system of the skin is enhanced, it is strengthened in that particular way with Ayurveda. In many cases, Sadhyo Vaman, Sadhyo Virechan is done. Some Purva Karma treatments are done for the, for the mind to be cool and calm, for the skin to settle down. So we see with all these procedures, the raised bumps, they are decreasing, scaling is gone, it is shedding off, it is now turned black, then the normal skin color comes. We have to differentiate between active diseases and passive diseases. Active diseases like the psoriasis, eczema and all. Passive disease or inactive disease like the vitiligo, like the lichen planus pigmentosus. These are diseases that tend to take more time because they are having no symptoms. Patients often tell us that I have lichen planus pigmentosus, no itching, I'm so lucky. No, you don't have itching, that's a problem in fact. It should have itching like the hypertrophic lichen planus, so it's easily, recovered. Although the silent diseases also recover, but it's just that it is a slow, improving condition. A lot of discipline, a lot of external applications for vitiligo, LPP is needed. So this is how Ayurveda follows. The treatment starts with Krumingna Aushadhi and the treatment ends with Rasayani Aushadhi. Rasayan Chikitsa, Rasayan medicines are important so that the disease does not relapse. It doesn't come back again. Hence maintenance is also very important. Doesn't mean once it's gone, it's gone. We need Rasayan to, strengthen and do the pushti of all the Saat Dhatus, all the 7 Dhatus. Dhatus are those that hold us. So these tissues also need rejuvenation. Rejuvenation therapy is a Rasayan therapy. So for incurable conditions, we see Ayurveda, has various different treatment modalities. It is the only science with so many treatment options for patients. Choose Ayurveda, choose wisely. Any doubts, any questions, we're here. Let us know in the comment section below. Until next time, from Jovis and the team, look impressive, be progressive.